Hello everyone, I'm Dr. Mohan Kumar V, consultant physician and ECP consultant at Revive Wellness Hospital, Mysore. So today again we have very interesting case. It's around 38-year-old Mr. Srinivas Kondapalli is from East Godavari district of Andhra Pradesh. So he had a very unusual presentation. So in the month of March, he had an fracture of left lower limb for which he was advised surgery, internal fixation. So at the time, he was evaluated for cardiac fitness. At the time when they did a echo, there was regional wall motion abnormality in the echo. So immediately they referred the cardiologist. They suggested angio, but at a later date because of the impending surgery. So immediately patient underwent surgery. Then after 3 months post surgery, after bed rest, he underwent angiogram. In the angiogram in the month of August, he was found to have coronary artery disease, triple vessel disease. That means three major coronary vessels had major blockages. So he had, what is very interesting in this particular patient is, it was a incidental finding of a coronary artery disease, number one. His young age is around 38 year old, very young age to have a coronary artery disease, triple vessel disease. Not only that, prior to that, he never had typical heart attack symptoms because already he had a regional wall motion abnormality. That means patient had a asymptomatic or silent heart attack maybe 1 year prior. So patient used to get exertional dyspepsia symptoms, not like typical chest pain. So whenever it climbs to stairs, he used to have some discomfort, acidity reflex sort of thing, and he used to take gelusil and he used to feel comfortable. That was the unusual presentation. So only during the time of surgery he was found to have this echo abnormality. Later when they did the angio, coronary artery triple vessel disease. Once they found coronary artery triple vessel disease in Andhra Pradesh Apple Hospital, where they did the angio, immediately he was advised to undergo coronary artery bypass surgery. Looking at his age and the patient's relatives and others, they thought, should we not explore any other alternative therapy if it is available? They were not willing for bypass surgery. Then they found out about our ECP center, which is located in Mysore. They came to our hospital, that is Revive Wellness Hospital in Mysore. So immediately they showed me all the reports. I evaluated the patient. I took the risk factor associated with this particular patient. He was not a diabetic, not a hypertensive, not a smoker. There was family history of coronary artery disease in the second degree relative, but his only risk factor probably I would say is dyslipidemia. And apart from that, he was working as a driver. That means he used to sit for longer duration of time in a driving position. That means long duration of sedentary lifestyle was there. So we can say these are the contributing factors for his coronary artery disease. Once we found out the angiogram report, so what we suggested him is ECP therapy. We all know ECP therapy is US FDA approved form of treatment for chronic stable angina as well as triable coronary artery disease. So we advised him 1 hour every day for 35 sessions. Patient underwent 35 sessions of ECP therapy. Post ECP therapy, he dramatically improved. He was able to walk 5 kilometers without any angina, that means without any chest pain, without any breathlessness. Patient felt really fantastic, and he was able to climb stairs, at least 5 flights of stairs as well. Patient felt comfortable. There is remarkable improvement. And post ECP therapy, we did a cardiac risk profiler study. In that, the cardiac coronary artery stiffness and peripheral arterial stiffness as well as carotid artery stiffness has dramatically improved. Not only that, from the patient's perspective, there is dramatic improvement in the symptoms. So patient without bypass surgery, he has underwent this particular non-invasive, very safe, US FDA approved ECP therapy, which has given him a very wonderful result. So to know more about from the patient's perspective, now I'll ask patient's wife's sister to talk about the experience she had in our hospital. ನೀವು ಹೇಳಿ ಇವಾಗ ಯಾವ ಥರ ಏನಾಯಿತು ಅಂತ. ನಿಮ್ಮ ಭಾವ ಅವರಿಗೆ ಕನ್ನಡದಲ್ಲಿ ಮಾತಾಡಿ.
ಫಸ್ಟ್ ಅವ್ರಿಗೆ ಆಪರೇಷನ್ ಆಯಿತು, ಲೆಗ್ ಸರ್ಜರಿ ಆಯಿತು ಮಾರ್ಚ್ ತಿಂಗಳಲ್ಲಿ. ಆವಾಗ ಅನಸ್ತೇಷಿಯಾ ಡಾಕ್ಟರ್ ಹೇಳಿದ್ರು ಅವ್ರಿಗೆ ಹಾರ್ಟ್ ಪ್ರಾಬ್ಲಮ್ ಇದೆ, ಬೇಗ ತೋರಿಸಿ ಅಂತ. ಆವಾಗ ಅವ್ರಿಗೆ ನಡ್ತಕ್ಕೆ ಆಗ್ತಾ ಇಲ್ಲ. ಆ 3 ಮಂತ್ಸಲ್ಲಿ ಫಸ್ಟ್ 2 ಡೇ ಎಕೋ ಮಾಡಿದ್ರು. ಆವಾಗ ಹಾರ್ಟ್ ಪ್ರಾಬ್ಲಮ್ ಇದೆ ಅಂತ ಹೇಳಿದರು. ಆಮೇಲೆ ಬನ್ನಿ ಅಂತ ಹೇಳಿದರು. ಆಫ್ಟರ್ 3 ಮಂತ್ಸ್ ಎಂಜಿಯೋಗ್ರಾಮ್ ಮಾಡಿದ್ರೆ ಅವ್ರಿಗೆ ಬೈಪಾಸ್ ಸರ್ಜರಿ ಕಂಪಲ್ಸರಿ ಮಾಡಬೇಕು ಅಂತ ಹೇಳಿದರು. ನಾವು ತುಂಬ ಭಯ ಆಯಿತು ಆವಾಗ. ಆಮೇಲೆ
ಅವಾಗ ECP ಬಗ್ಗೆ ನಿಮಗೆ ಗೊತ್ತಾಯಿತು?
ನಮ್ಮ ರಿಲೇಟಿವ್ ಹೇಳಿದ್ರು ECP ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಿಸ್ಬೇಕು ಅಂತ. ಈಗ ಚೆನ್ನಾಗಿತ್ತು.
ಆಯ್ತು. Okay, now from the patient's perspective, let us hear from a patient. How does he feel prior to and post ECP therapy? He doesn't know Kannada, so he'll speak in Telugu, his mother tongue. What is your experience?
సార్ ఈ హాస్పిటల్లో చాలా బాగా చేశారు ట్రీట్మెంట్. స్టాఫ్ అండ్ డాక్టర్ గారు అందరూ కూడా బాగా చూస్తున్నారు. ఈ డాక్టర్ గారి పర్యవేక్షణలోనే ఇక్కడ నాకు ECP ట్రీట్మెంట్ జరిగింది. నాకు మొత్తం తగ్గింది. ఇప్పుడు నేను 5 కిలోమీటర్స్ కొండ 5 కిలోమీటర్లు వాకింగ్ చేయగలుగుతున్నాను. నాకు ట్రీట్మెంట్ అంతా చాలా బాగుంది.
So he says he is able to walk comfortably 5 kilometers post ECP therapy. Prior to that, he had lot of atypical angina symptoms. So what I would like to say here is the benefits of ECP therapy in such a patient scenario. It is very, very safe, US FDA approved form of treatment. Probably not many cardiologists, not many physicians, not many patients are aware about such a wonderful therapy. I request all the persons concerned, whoever is the treating physician or the patients, let us try to find out about more and more about ECP therapy. It is one of the safest and US FDA form of treatment which is available, which is underutilized. So if the benefit of this treatment is not only for chronic stable angina, stable coronary artery disease, it works really wonders in heart failure as well. Somebody who has got an ejection fraction 20%, if he undergoes the therapy along with gold guideline directed medical therapy, definitely the ejection fraction improves up to 50 to 60%, which is normal ejection fraction, which we have seen in majority of the patients. So it is a wonderful treatment which is unfortunately underutilized. I request everybody to look into this form of treatment. You can get a lot of videos, lot of Google reviews regarding ECP therapy. Explore this particular option, at least in some patients. It really works wonders. With that, I would like to conclude my today's discussion about ECP therapy. Thank you, everyone.